Hello friends, today we are going to talk about hemolytic uremic syndrome. So, what is hemolytic uremic syndrome? Hemolytic uremic syndrome is a thrombotic microangiopathy affecting mainly the children. It has pico-oral transmission. It is mediated by two types of toxin, Shiga toxin and non-Shiga toxin. Shiga toxin mainly affect children between 6 months to 5 years of age. Shiga toxin act by inhibiting the 60S ribosomal subunit and halting the protein synthesis. Shiga toxin is most commonly caused by E. coli having serotype O15787. It is also caused by Shigella dysentery type 1. Non-Shiga toxin mediated hemolytic uremic syndrome is also known as atypical hemolytic uremic syndrome. It is complement mediated process caused by autoimmune diseases, drugs, and infection. So the important point to remember is that Shiga toxin is mainly caused by bacteria E. coli O15787 and non-Shiga toxin is caused by autoimmune diseases, drugs, and infection. So now in this slide we will look into the pathophysiology of Shiga toxin mediated hemolytic uremic syndrome. First of all, we have infection with enterohemorrhagic E. coli. Then E. coli cause mucosal inflammation that facilitate bacterial toxin entering into the systemic circulation. These toxins then cause endothelial cell damage. Damaged endothelial cell then secrete cytokines. These cytokines cause vasoconstriction and platelet microthrombus formation at the site of damage, causing thrombocytopenia. So let's look at the clinical picture of the hemolytic uremic syndrome. So as it is a consumptive coagulopathy, so we have thrombocytopenia. We also have microangiopathic hemolytic anemia. So what's the reason behind microangiopathic hemolytic anemia? It is mainly due to mechanical destruction of RBC in the microvasculature. So we also have the characteristic finding of hemolytic anemia, which is characterized by decreased hemoglobin, increased indirect bilirubin, and decreased heptoglobulin. We also have on peripheral smear, we have schistocytes. Schistocytes are fragmented RBCs present on peripheral smears. Look at the photograph on the side, which are schistocytes are encircled. We also have acute kidney injury. What is the reason behind acute kidney injury? The reason behind acute kidney injury is that the sugar toxin mainly affect the renal artery, causing decreased blood flow to the kidneys, which decrease glomerular filtration rate and causes an increase in creatinine. Another characteristic finding of hemolytic uremic syndrome is bloody diarrhea. So now let's discuss about the treatment of hemolytic uremic syndrome. The treatment for hemolytic uremic syndrome is mainly supportive. What does supportive treatment mean? Supportive treatment means that give what the patient requires, always give it to the patient. Means if he is volume deficient, give him IV fluid. If there is acid-base disorder, correct the acid-base disorder. If there is electrolyte imbalance, then correct the electrolyte imbalances. Plus, avoid giving antibiotic and anti-helminthic because they increase the risk of hemolytic uremic syndrome. Now, what are the differentials? Or the exam will try to confuse you on these differential by thrombotic thrombocytopenic purpura and DIC. And thrombotic thrombocytopenic purpura, patient have fever and focal neurologic deficits, while DIC will have increased PT and APTT levels, which will be normal in hemolytic uremic syndrome. So what are the complications of hemolytic uremic syndrome? It is characterized by seizures, stroke, and coma. So let's dive into an example of hemolytic uremic syndrome. So we have a 4-year-old boy who have bloody diarrhea for past 1 week after eating uncooked hamburger at a family barbecue. Physical examination show pallor and mild petechiae. Hemoglobin is 8.2, platelet 60,000, creat 2.1, and peripheral sphere has fragmented red blood cells. So on the previous slides, I have mentioned cystocytes, but here I have written fragmented red blood cells. On exam, you are always tested not only of the clue word, but what you have to understand what the clue word means. So schistocytes are basically fragmented RBCs, and the exam most of the time they will not give you schistocytes, but they will give you fragmented RBCs. So try to learn that what are schistocytes, what are the clue words, and what that specific word means. So then they ask us what is the mechanism responsible for this patient condition. Autoantibody mediated platelet destruction, deficiency of ADAM TS13 causing large variable factor multiples, Shiga toxin mediated endothelial injury leading to platelet activation, complement mediated intravascular hemolysis from CD55 deficiency or immune complex deposition in glomerular basement membrane. So if we look at the options, so the most probably it is hemolytic uremic syndrome, and it is mainly caused by sugar toxin mediated endothelial injury leading to platelet activation. The other options are autoantibody mediated platelet destruction, mainly into immune mediated thrombocytopenia, deficiency of ADMTS13 causing large von Willebrand factor multiple. It is TTS, thrombotic thrombocytopenic purpura, and I have told you that it is characterized by fever and neurological deficits which are absent over here. Complement mediated intravascular hemolysis from CD55 deficiency is in paroxysmal nocturnal hemoglobinuria, which will have absence of fragmented RBCs, and creat level will be normal. Immune complex mediated immune deposition in glomerular basement membrane is characterized by it is a post-streptococcal glomerulonephritis which occur after 2 to 4 weeks of pharyngitis, and it's so the main option is Shiga toxin mediated endothelial injury. So the answer is C. That's all for today. Thank you so much.